This is Mitchell Shiffman. I'm Director of Liver Institute of Virginia, a part of the Bon Secours Mercy Health System in Richmond, Virginia. We all have patients who have cholestasis, an elevation in alkaline phosphatase. We work them up. It's not primary biliary cholangitis. It's not primary sclerosing cholangitis. It's not any of the other infiltrative disorders. All of these patients may have had probably have had a MRCP to exclude these disorders. All of them have had serologies to exclude various liver disorders. And many of them you may have had a liver biopsy on to try to figure out what is causing this unexplained cholestasis. And at the end of the day, and at the end of this workup, you don't know, we have no answer. We don't know what's causing this. One of the causes of cholestasis in children is progressive familial intrahepatic cholestasis. This can be a very severe disease in children with very high levels of alkaline phosphatase, high levels of bile salts, liver injury, progression to fibrosis, and the need for liver transplantation at a young age. We hypothesized that these adults with unexplained cholestasis have a mild form of this genetic abnormality. And so we identified 62 patients with unexplained cholestasis. They went through all the testing that I've mentioned earlier. Serology was negative. Liver biopsy was performed in 75% of these patients. Most of that showed mild nonspecific inflammation, and a couple of others showed a little bit more fibrosis, but we didn't really know why. MRCP was negative in all these patients. And so what we did in these patients with unexplained cholestasis is we measured a gamma GT, serum bile salt, or serum bile acids, and we did genetic testing, which is now readily available as a cholestatic genetic panel. This genetic cholestatic panel evaluates for gene mutations in 70 genes that have been associated with cholestatic liver disorders. To our surprise, 88% of these patients had a genetic defect in one or more of these genes associated with cholestasis. And more importantly, 13% of these patients had either a genetic abnormality in one of the recognized genes for PFIC, progressive familial intrahepatic cholestasis, or Alagille syndrome. Some of these patients had fairly severe itching. And when you go through your steps of trying to treat itching, you start with antihistamines, rifampin, cholestyramine, some patients naltrexone. Those patients that had severe itching, refractory to all of our standard therapies, were treated with an IBAT inhibitor, and all of these patients improved with a lowering in their bile salt or bile acid concentrations. So this study demonstrated that genetic abnormalities probably accounts for the overwhelming majority of unexplained cholestasis. Genetic testing should be done in your patients with unexplained cholestasis and may lead to an explanation for why the alkaline phosphatase is elevated and why these patients have cholestasis, and may provide a treatment option for that subset of patients with cholestasis who have severe pruritus as part of this disorder.